Hi guys, Margaret, Judy, Brittany, Andrea, Jennifer, Kelly, Nan, Carrie, Jacqueline, Lola. Um, this is wonderful. I'm glad you guys are all here. We've got some amazing women with us. We're going to talk about functional fitness from Bump and Beyond, which I always love. We always end up talking and saying kind of dirty girl words, and it's always so fun for me. These are real experts we have with us. We have Brittany Citron, and she launched PROnatal Fitness in 2015 after an eye-opening experience during her first pregnancy, alerting her to the critical need for better education and resources to support women during pregnancy and the postpartum period. I love these. I want to hear about the trauma. You got to share the dirt. I promise everybody has to remind me to share my little special story about share. Remember that? Okay.
Yes.
Gretchen, don't forget to remind me. And then we've got Gretchen Gegg. She's a highly experienced fitness instructor, educator, and presenter. Her experience with various populations and their need for more than just fitness, led her to the MiMo Method. And this virtual wellness platform supports clients as they learn to reframe their thoughts around food, activity, and body image. This is so important during pre-pregnancy, pregnancy, and postpartum. And frankly, hello, 25 years later. It's because it still nags at you. It still nags at you. And then I'm really glad to have Kim Volpini. And I was joking with her. Do you see her title? Look at her Zoom title, the Vagina Coach. I love the word vagina, and I think it takes a lot of guts. I was going to say it takes a lot of balls, but I won't, to actually name it. And I think the name of your company is beautiful. It's Pelvian Wellness, which is a French word for pelvis. And she started in 2004, and she really focuses on the entire pelvic floor and different ways to prepare it, rehabilitate it, deal with it. And I think that that's great. And they're just these wonderful experts. And I don't know if you guys know, but I actually wrote the Moms in Motion book and worked extensively on the Moms in Motion pregnancy certification that SCW has. I have 4 kids. Kim, how many kids?
2.
2 kids. Gretchen?
2.
You've got 2, and you got 1 you're still nursing. Yes. And Brittany, you've got 2.
2, yep.
Yes. And you have a very well-trained husband who's right now putting her kids to bed right now. Yeah.
Well, we're hoping.
Don't care.
We're hoping.
You can't see them. You can't smell them. They're not your problem. Okay. That's
right.
Except when they go to college and you get, whatever calls from hospitals that say your kid was just too drunk and blah, blah, blah. Not that that's ever happened to me. So what we want to I know, Gretchen, you think nursing, that it's going to end after that ends. Trust me, as I told you, they're on your breast until they're like married with their own wife. And then I'm sure you're going to get a phone call. How should training differ in each trimester? And we said trimester, and I'm shooting to you, Gretchen. You said something very wise.
Well, there's more than, after a trimester, people say the 4th trimester, right? We were talking a little bit about, well, that doesn't mathematically make sense. But we were going back and forth, all of us, well, how long is postpartum? And really, it's eternity is what we came up with. But yeah, and as far as the training, for me, it's all about the mindset of the time. It's not just these 3 trimesters, it's the rest of your life. Like everything's going to change, not just physically, but mentally as well.
Yeah, and preparing for that. So how should training differ in each trimester? Brittany, you were sharing some information on that about what happens in the body at these different levels.
Yeah, well, we actually, we view this whole period like you're training for a major athletic event, because there's an incredible amount of stress placed on the body, not just during pregnancy, but in childbirth, and then the very physical demands of new parenthood. So we actually approach training for this entire journey like you're training for an athletic event. And we have different training stages. They don't necessarily correspond to trimesters, but we have certain objectives that you have to accomplish because, again, we want to think about how do you prepare your body? What do you need to start doing? Not just, oh, what do I need to modify? So our training stages, we call them foundation, strength, and birth prep. So in the foundation stage, that's when you're laying the foundation. You're kind of learning about proper alignment because pregnancy is going to shift your alignment a lot. So you're learning about neutral alignment. You're learning about proper deep core activation because it's something that a lot of times you don't learn in traditional fitness and in terms of proper breathing mechanics, the pelvic floor activation. So how do you get those deep core muscles working? And then a big piece of what we work on in the foundation stage is not only fundamental movement patterns, the basic squat, lunge, push, pull, etc., but new parenthood ADLs. Because Sara, we were just talking, you know, before this, activities of daily living, and these are all the activities that you're going to be doing as a parent in the early stages when you're exhausted and recovering from labor, and then later on with a 30-pound toddler, maybe another one, and then bigger kids. But the squatting, the bending, the lifting, the pushing, the pulling, and you want to make sure you know how to move with proper movement mechanics to help expedite your recovery and kind of avoid pains and injuries. And then we move on to this. Yeah, go ahead.
Oh, what I was going to say is what I love you mentioned is the deep core. And that's Kim's specialty.
Yeah.
So please finish, and I'm going to ask Kim about that.
Yeah. Well, the strength stage is really where we focus on kind of building strength to prepare the body for all the stresses of the increased weight gain and alignment shifts. You know, a lot of times you hear, oh, you have to decrease your weights during pregnancy or avoid strength training altogether, but to mitigate the risk of pains. But in the end, that can actually cause more pains and injuries because your body's not prepared to cope with those stresses. So we want to make sure we're building that strength.
Right. And then by building the strength, it's also got to go from the inside out. So yeah. Kim, my vagina guru, tell me when we start to train the pelvic core, the pelvic floor, and how do we realign and strengthen our core?
Yeah, great question. And I hope that one day we actually have already learned how to train our pelvic floor at a much earlier age than before we're pregnant, because I think the conversation needs to start earlier. But when usually pregnancy is when people first hear, do your Kegel exercises or anything about the pelvic floor. And social media has definitely increased awareness. And Brittany covered a lot of the same philosophy. So I view birth as an event that we're training for. We need the principle of specificity to be applied there. We use periodization throughout the trimesters. The first one, and it can be dependent on the person's, some people just feel like hell in the first trimester, and they may be sick or they may be tired and their energy levels might not be there, but it's a great time to talk about things like alignment, like connecting in with the pelvic floor, because even if you're in bed not having a lot of energy, you can still start to do that connection between the brain and the pelvic floor and learn what it means to actually breathe in coordination. I call it the core breath, the breathing in coordination with the pelvic floor, and learning what it means to contract and lift, but also what it means to relax. So the first one is kind of like, it's connecting with your core and understanding the physiological changes that are happening. The second phase is about building up some strength with suppleness at the same time. And the third one is where we start to taper off. So kind of like when we're preparing for a marathon, we have the gradual buildup, then we have a taper off before a race day. And then we conserve our resources. We start thinking about how are we preparing for our recovery? What are we going to be doing, for our activities of daily living? Who's going to be supporting me? Who's my team? And then we go and we perform and we give birth. And then we already have the plan in place from the recovery, because any fitness event that we typically train for, there's an element of tapering off. There's an element of recovery built into that periodization. So we need to treat birth the same way. And pelvic floor is important the whole way through, but in those last few weeks of pregnancy, we really focus on learning to surrender. Perineal massage, activities like I have a pool noodle release that you sit on. So you're introducing sensations of stretch and discomfort and pressure so that we can try to, as closely as we can, mimic what happens in birth, but learn how to soften and how to release tension and make sure that our pelvis is going to respond appropriately when we give birth.
Oh, it's very good information. And what always makes me laugh is I'm sure everybody on this call right now is doing a Kegel. you know, you just, it's just, I don't know. And poor Mike Lieber, who is our amazing cinematographer, is probably sitting here very uncomfortably enjoying this conversation.
Guys can do Kegels too.
Yeah, yes, they can. And it's, and that's very important. And Gretchen, you tend to focus more on the mind and how your entire environment, and not just your physical well-being, not that I think either Kim or Brittany are exclusively focusing on that, of course you can't, but how does your environment affect you, and how does a woman's self-esteem transition from trimester to quadmester, whatever that fourth mester is?
Yeah. And, you know, Kim, you mentioned about social media, and there is this heightened awareness of a lot of things. We are seeing a little, you probably saw that my focus is body positivity first and foremost, and I could go there all day, but we also are still getting a little bit of that, get your body back, or get back to baby weight. And this kind of push that women are being indoctrinated with, even from the very beginning, probably even before they're pregnant. They're like pinning things to a Pinterest board for after the baby's born that's going to help them get their body back. And their mindset is body, 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 physical, 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 not like you guys are saying, there's an event that I'm preparing for. And unlike a marathon, I don't go home and recover. I go home with more work and a new event and a body that's been, you know, maybe literally ripped apart, right? So we've got all these things going on. And I mean, we're dealing with mindset stuff, like even postpartum depression, that's like a chemical imbalance. And so we can't just say, here's our physical stuff. We have to look at, how are we thinking about ourselves? And are we going to address that ahead of time? Are we going to work with someone who will maybe help us through that, or just give us a good mindset and someone to talk to, and maybe prevent some of these really scary situations of, you know, real depression after the fact? So that, for me, that's a really important part of the pregnancy postpartum process, is our mental health.
And that's so important. It's so important to look at the total person. I mean, we're trained to do this, but we don't always do this. And here comes my dog. Okay, don't you love this, right in the middle of a webinar. One thing I want to mention to everybody on the call is, please do me a favor, move your mouse, if you would, go to the bottom of your screen. There's a green share button. Go to the left. You're going to see a little red one in the chat box. Click on it. And if you would, type in your questions, or if you have a comment or something that you want to know more about, please type it in, please share it with us, because we're, you know, I hate these webinars. I love the webinars, but I hate that they're only 45 minutes, and I want to make sure we answer the things that interest you guys. So what cardiovascular, musculoskeletal, and hormonal changes happen in the body during pregnancy? Kim, I'm going to kind of start with you, because I know the focus of your practice is the pelvic floor, but how do all these, the cardiovascular, musculoskeletal, and hormonal changes really affect us during our entire pregnancy?
Yeah, so skeletally, early on, we may not, the changes can happen quite quickly and we may not notice them right away, but our pelvis will often start to tip a little bit more forward. And then as the weight of the babe grows out in front of us, it starts to shift our center of gravity. And people's unconscious response to that is usually to start to lean back, and they sort of start to thrust their pelvis a little bit forward, and the pelvis ends up in a bit more of a posterior tilt, and there's more tension in the back part of the pelvic floor. There's typically more back pain associated, and the pelvic floor muscles themselves, actually, they're holding on to more tension, trying to manage this load. And when I was talking earlier, we want to learn how to surrender and soften and release tension. So our posture can sometimes work against us. So skeletally, we have, I always say how you hold your skeleton matters, because the muscles will adapt to how you hold your skeleton. And so if we can be more mindful of what would be considered neutral posture or neutral pelvis, then the muscles are less likely to adapt to that kind of short, tight state, or where they're holding on to more tension. And then circulation wise, we have the body has to work harder to distribute the blood around the body. And that can lead to sometimes we feel a little bit breathless or a little bit less energy. And then as the pregnancy advances, there is less space. We can't breathe as efficiently. We don't get as much movement with the diaphragm, and the diaphragm and the pelvic floor love to move together. So when that isn't happening, again, the pelvic floor can sometimes be a bit of a victim. I think that's a strong word to use, but you know what I mean? So being aware of all of the physiological changes that happen and how they can influence, not, of course, I'm biased to the pelvic floor and the abdominal wall, but it really influences our whole body state. When we don't breathe as well, we don't have as much energy. Our digestion can be impaired. Our pelvic floor function can be impaired. So when we have the awareness and the knowledge to recognize that, we can step in and make changes. But if we don't have this knowledge, which so many people don't, it just happens. And then they've given birth, and now their body has adapted to this different posture. And now they're wondering, why am I leaking urine? Why do I have this sensation of pressure? Why do I have this chronic back pain that I can't get rid of? And a lot of it comes back to the adaptations that our body made kind of unconsciously as we were adapting throughout those 9 months to the pregnant person.
And what I found so interesting, what happens to the body is you put this weight on so quickly. I mean, really, you're putting 30 pounds on, 40 pounds on, and embarrassingly enough, I put 50 pounds on, like, boom, right away, not right away, but within 9 months, and it's all in one area. It's not like, well, I'm kind of getting big all over. Yes, certain things swell and it does change you, but it's so out front that the alignment and being pulled and the relaxin in your system, which is a hormone that does what it says, it relaxes things. And the hips externally rotate about 4, and I can't remember which one of you said 5 degrees. And the rib cage expands. It expands because you've got to have room for the baby. And I think I told you guys the story before we turned the camera on of trying to put my wedding dress on after I had kids. And I was like so excited I'd lost all the weight. Well, I'm sorry, your hips, the relaxin stays in your system, but it doesn't always, your hips just don't magically go back. It's like you're there and your jeans are never going to fit the same. And I couldn't get into my wedding dress because I got in all the way up until like I was supposed to zip it up over my bra. And I'm like, my rib cage had just expanded. And here's Gretchen's favorite gossip story. I read this out. Okay, it was a million years ago because I think she's 120 right now. But Cher, after she had Elijah Blue, she had, oh, stop it, Brittany. She had 2 ribs removed because she didn't like the way her ribs flared out. I think that's dramatic. I would like, Botox is kind of like the end of where I'm going to go. But it's like, that was, the body just changes. And speaking of Brittany, now you can jump in and give me some more science rather than the humiliating People magazine information I'm sharing. But what are some of the exercises that Kim so articulately explained, the alterations that happen in the body? What are some of the exercises that you think in the different trimesters or cardiovascularly, musculoskeletally, and hormonally that can help us deal with these physiological changes?
Well, we always say the number one most effective exercise, or the number one most effective core exercise is, we all probably have different ways of articulating it. We call it 360 breathing. But as Kim mentioned, how you breathe impacts every system in your body. And so that's one of the first things we teach, is how to breathe through the diaphragm. And because a lot of us, especially because we're used to sitting all day, are breathing from the accessory muscles up here. And when you can learn to breathe through the diaphragm, not only does it improve your health, your alignment, every system in your body, but it's also actually creating a healthier growth environment for the fetus, because with that rhythmic pumping of the diaphragm, with each inhale you take, you're delivering more oxygen and nutrients to the fetus. With each exhale, you're ridding the body of toxins. So you're creating this healthier growth environment. So that's really kind of the first thing we teach. And then, if you want, we can kind of talk through how to do it. Do you want me to talk through how to do that?
Go for it. Yeah, I'm sure people would
All
love
right.
it.
So if everyone's kind of sitting up tall in a chair and your feet flat on the ground, I know you can't really see me, but I want you to take your hands and place them around your rib cage so that your thumbs are in the back and your fingers are kind of in the forward, wrapping your rib cage. And you're just going to take deep breaths in through your nose and out through your mouth. And as you breathe in through your nose, you want to inhale and kind of breathe into your fingertips. So you're feeling that rib cage expand 360 degrees. And then as you exhale, you kind of feel everything close in. So try a few repetitions of that on your own. Inhaling and feeling that full 360 degree expansion into your rib cage. And then exhaling and feeling everything close in. And if you did a few repetitions of that, you'd probably feel your body start to calm, because that's actually activating your parasympathetic nervous system, that rest and digest nervous system. So that style of breathing is something we try to teach first, and then incorporating how you incorporate that into your movement to become your natural style of breathing. And then of course, the pelvic floor, we call our pelvic floor PFAs, pelvic floor activations, because sometimes the word Kegel, people associate it with just like the squeezing of the pee stopping muscles. But it's, Kim talked about that's kind of only the front of the pelvic floor. And we want to think about the back of the pelvic floor as well, and the sides. And we also don't want to think about constantly clenching the muscles, right? It's important, like any muscle in your body, you want to make sure those muscles know how to lift and lower, work through a full range of motion. And especially for pregnancy,
What I like, Brittany, what you brought up is, I love that breathing, because I think it's a great way to start your workout. And it's also a great way to end your workout. Like, I know I taught, oh my gosh, I think I taught for 15 years at Northwestern Memorial Hospital in downtown Chicago. I taught pregnancy and exercise at the Women's Center there. And, these women are coming from work, and they're coming from other kids, and they're coming from their, their toddlers or their husband or their home, wherever they're coming from. And they're just like, nothing's about them. And this is the only thing that they can, I'm seeing you nod, Gretchen. I mean, again, you're my spiritual guru here, all right? But it's like, to get them to focus and center on themselves and realize that if they take care of themselves, they can take care of their family. I mean, what are some of the things, Gretchen, that you do to get people prepared for the work of motherhood?
So as I teach fitness as well as I life coach. So, but with both of them, and you guys both were talking about this, the breathing is so crucial. And the whole clenching and holding of the pelvic floor, like, how spiritual hippy dippy guru are we going? I mean, we can talk about having that trauma. It was trauma. And having that clenching and holding. And so when everything's kind of going crazy around us, we hold that. And so then our breath is just up high and up here. And even if we're getting into the rib cage, we maybe aren't getting that synchronicity between the diaphragm and the pelvic floor because we're holding so tight. So our diaphragm's still, struggling. But I teach it as part of self-care, and I teach a 5 breath strategy. So I walk women through, whether they know what I'm walking them through or not, this kind of holding, getting that deep abdominal core activation, sitting up tall, kind of feeling that length, and then breathing as if you're breathing all the way down through the pelvic floor, and then coming all the way back up and feeling that relax and contract, but allowing that not to just be a breath, but to be a signal. So every time you're entering this moment of self-care, which I'm talking them through as a coach or actively putting them through without defining it in a fitness class, we start with the breath. We start with 5 breaths. So mindset wise, what it does is it teaches our body that when we start or stop rather, and focus in on those 5 breaths, we're entering into a place of self-care. It's just subconscious. Our brain knows it. So we start to take care of ourselves a little bit. We can do the things that physiologically help us, which is release the tension, find that length, settle back into posture, and then psychologically or mentally, what help us is bringing that back into, hey, I'm worth taking care of. So it's just this really cool balance. I'm just sitting here enjoying this time because I'm thinking, oh my gosh, all this stuff. And then if we put it together with the brain and let the brain do its thing, we can teach people this really, really short and sweet. And, you know, anybody that's out there thinking, well, I don't know when I'll use this because I just teach group fitness. You can use all this information. It doesn't have to be a 4,000 or 5,000 week long scenario. It can be a quick thing like that.
And now this is a real pointed question, but what exercises should be completely avoided? Kim, do you have any ideas on, is there anything that we should completely avoid?
I know this is a debated topic, and I think that pregnancy used to be a time where you were, confinement and you didn't do anything because you're pregnant and that's it. And then it went to the other extreme where people are doing box jumps and holding planks for 5 minutes and skipping, and they're just like, doesn't matter, I'm pregnant. And I fall somewhere in the middle. So my philosophy is I look at, again, what are the demands of labor? What birth positions am I going to be in, and what are most optimal, and how can I train for those? So box jumps, you're not going to box jump a baby out. You're not going to skip rope. You're not going to hold plank for even 30 seconds while you're in labor. So there's no real purpose for them. And also I look then also at what could the potential risks be. So we already have additional strain placed on the pelvic floor. We have the musculoskeletal adaptations that are happening that can influence the pelvic floor. So do I need more pounding on that group of muscles? Then if I'm in a plank, so I already know I've got stretch that's influencing the abdominal muscles, the alignment of those muscles, the connective tissue. Does it make sense to be in a forward loaded position for extended periods of time? So while I don't want to place restrictions on people, I get people to say, okay, so this is the exercise. What's your goal of doing that exercise? Will it train you to birth better, or to even as a recovery mother, like the activities of daily living? Will it help you train for any of those? And if so, then let's keep it in, and let's make sure that your execution of that exercise is not hindering you, is not influencing the pelvic floor negatively, is not pushing additional strain and potentially leading to an exacerbation of the diastasis. So that's so.
And just to give a little definition, the Diastasis Recti, it's with the ab muscles. Oh, great. We've got a drawing. It's
so here's the
Yeah.
rectus muscles. These are your two six packs. The linea alba is in the middle. That's the connective tissue that holds those two rectus in place. And what's misleading about the definition of diastasis? So diastasis means separation of the rectus. Diastasis recti is separation of the rectus, but there's always a separation there. We always have a gap. Nobody's ever determined what is considered normal. Nobody's been measured beforehand. So after you measure after pregnancy, maybe that was the size that you had before you gave birth. And so it's created a lot of hysteria. It's something we need to acknowledge. It's something that we should be assessing for, but it's created a lot of madness. So I usually don't advocate for sustained forward held positions. I use more dynamic, like deadlifts. And I don't recommend that we do high intensity pounding type activities in pregnancy. That's my philosophy, but it's an informed choice. So I let the person decide, is this going to help you birth better? What are the risks? What are the pros? And then they make their informed choice from there.
Right. And is this going to help you with when you become a mother? Like, are you going to be are you going to be on all fours, on your toes and on your hands, carrying something underneath you that is that heavy? Yeah. And I know Brittany brought up something about strength training, and I have read an article. I always talk to Len Kravitz about this. One of my favorite gentlemen in the world.
Love Len.
Yes. And he wrote a wonderful article on pregnancy and exercise with all the research. And he talked about when you strength train, reduce the amount of weight and increase the number of reps. And I always look at him and I just shake my head. I'm like, no, because you're going to end up with this 10-pound thing you're going to be carrying around constantly. All right. Well, my kids were like 10 pounds. I'm sure someone has normal children that are like 6 or 7, but my babies were always like monsters, and you're carrying them around. I'm not saying that you should start doing deadlifts and working at 90% capacity and only doing 6 reps. but my goodness, I think we should be working at 80% capacity, doing 8 to 10 reps.
Yeah.
You know, maybe not 12, maybe 10, but listening to your body and preparing for strength. So Brittany, I'm going to let you take this away.
Well, no, you're right. First of all, any movement is better than no movement, but yeah, I mean, that is training muscular endurance, but we talk about, you know, if you think about your strength to weight ratio, if you continue to decrease your resistance throughout pregnancy, your muscles are going to grow weaker, right? A progressive overload. Your muscles need to be stressed in order to tolerate greater levels of stress. So your strength will continue to go down as your weight continues to go up. So at the end of your pregnancy, when you have the most weight to carry around and the most stress on your body, you're actually at your weakest, and that's what can lead to injuries. So, you know, we actually in the strength stage, which is maybe around your second trimester, we're in the maybe 8 to 10 reps, which is around, you know, 80 intensity. So that means you can do about 8 repetitions or up to 10 repetitions without feeling fatigued. That's kind of the range to help you build strength.
Yeah. So. And what the other thing is, if a woman, we always get this question. I don't know if you ladies hear it, but you know, I don't exercise. I've got to start now. I'm pregnant. And I remember the old ACOG guidelines that used to say, if you haven't exercised before you got pregnant, don't begin now. And I was like, oh my, so how am I supposed to do, you know, 7 to 14 hours of labor if I'm not exercising and preparing my body? All right.
Thankfully, ACOG has changed that guideline.
I know they changed it like in the 90s, yes. They changed it. But it's like, so we've got to look at a pregnant woman. They're going to walk in. I'm looking at all these people on this webinar. They're going to walk into a regular class, into any class. They're just going to walk in. You're not even going to know they're pregnant until a few days later. You're like, they're really bloated. And you can't ask them. You know, you can't say, oh, are you fat or are you pregnant? You know, no, I'm postpartum. Like, thank you for that. You know, is there anyone in the room? How many have done this? Is there anyone in the room who's with child? You know, and then they're like, then they raise their hand, thank goodness. But it's always a general question. And then they're like, I haven't been exercising. What should I do? And I'm like, take somebody else's class. No, but start gradually. You start them out like you would start anyone in a fitness program, which is very gradually. I want them to come into my class or come into my personal training session. And my goal is that you finish class and you really don't feel anything. You feel okay. All right. If they're sore right after class, you're in trouble because they're going to be in pain the following day with that delayed onset muscle soreness. But if they just feel like, oh, I feel kind of refreshed, and they're still going to feel it the next day. Gretchen, how do you approach somebody who wants to begin an exercise program that hasn't exercised before?
Pretty much the same way you just said. You just bring them in gradually. I will say one of the challenges right now, I'm getting a lot of clients. I run a virtual yoga studio, right? So I'm getting clients that I can't see a lot of times. So the challenge for, I think, us as fitness professionals right now is a lot of verbal cueing and a lot of options. And, we don't say the big fat scarlet letter M modification as much. We give them, maybe today you feel this way. I always have a chair in my fitness studio, AKA garage. So I'm just showing them lots of options. And while there's no research evidence, my hope is women that are coming in, because I do have a couple pregnant clients that are coming in, are maybe doing even better because they're not sitting in that gym scenario. So there's no competition and they really are listening to their body. And I've also seen, I was thinking about this side of it. I don't know if you guys have seen this. I've had clients too who are very fit, and then they come in and they're wanting to do what they say, which is maintain the same level. Awesome. I did a triathlon last week. But then they're hit with these hormones in the first trimester and they feel like absolute crud and they don't want to do anything. And again, mindset, they're like dealing with a little bit of guilt, and they kind of do an all or nothing approach. So they throw it all out the window in first trimester. And then we're having to kind of retrain, but we're having to retrain the entire mindset of, okay, not only did you detrain a little bit, but now you're dealing with a totally different body. And so I think it's also really powerful to let women, okay, rest when you need to rest. But, and I think Brittany was the one who said it, like doing something is better than doing nothing. So even though you're really fit and you're really athletic and you're used to doing the box jumps, doing something, sitting down in a chair and doing yoga-like movement is going to be better than sitting on the couch eating potato chips in front of the TV. So that's kind of an interesting thing that I've seen in the past and continue to see.
And Kim, I wanted to ask you, and actually I'm throwing this out to everybody, but what symptoms do you guys recognize that means somebody should stop exercising?
Pain is a big one. So pain and bleeding. So if anybody notices any preterm bleeding, then of course that's going to be go and speak to your healthcare provider right away. And any sort of pain, like there's discomfort and there's pain, and discomfort can be usually well tolerated by anybody. But there can be, I mean, we have research, I don't even know why they needed to do the study, but we have research to show that pregnant people have more back pain than non-pregnant people. So there's going to be discomfort. Often it's common to experience discomfort while you're pregnant regardless. And then when you add on resistance training, especially if it's somebody who hasn't been active before, then they may experience a little bit more discomfort than what would be considered normal. So we kind of have to, you know, and especially if somebody who's never exercised, that discomfort to them might be pain. And it may not always be something that we need to refer on to their healthcare provider. But if it's extreme pain that's limiting their ability to move, like to walk, or if they're experiencing any bleeding, then I would definitely be referring on from there.
Yeah, and I really like that you brought this up, pulling the doctor in, pulling the physician in. I think a lot of you guys know that I'm a lawyer by education, so you've always got to get at least two things. You've got to get the doctor's release, and you've got to have them sign an informed consent form, which is a waiver of liability. And I'm going to add a third form now. You've got to add a specific COVID release as well, if you're getting them into any live program. We've supplied these in a number of the other webinars. So you can always go into the recording area and download it on those lovely little red download marks that Mike Lieber is so kind to put in after the webinars. But it's important to do that. Brittany, is there anything else, any other markers people should look out for their clients?
In terms of to stop,
Yes.
Dizziness, shortness of breath, sudden swelling, if it's a sudden, not general swelling, but kind of sudden swelling or sudden headaches, those are signs to stop. And then kind of two things to look for that maybe the movement you're doing is not appropriate. One is coning in the belly. That's the sign of the diastasis, right? So that just means that movement is not appropriate for your body at that time. So stop it. And then leaking, any sort of leakage. And a lot of women, you know, we talked about this earlier, think, oh yeah, I had kids, I pee my pants, that's normal. Just because it's common doesn't mean it's normal. That's a sign of pelvic floor dysfunction. So stop that movement. So those are two good ones to kind of use that, hey, this movement isn't appropriate for my body at this time.
Are there any exercises that can help repair the diastasis recti, the separation, to at least pull it back into a normal parameter? Kim, you're the vagina coach. I think you're the diastasis doctor at this point too.
Well, I don't know about that, but okay. So diastasis has been something that I've been working with for a long time. And early on, I recognized a link between the pelvic floor and the abdominal wall. And I wasn't quite sure. We didn't have a lot of research. We still could do with a lot better research. Most of the research focuses on the interrecti distance. So as I was talking before, there's always an element of interrecti distance. Nobody's ever determined what's normal. So it's difficult when all of the research relies only on interrecti distance measurements. We're starting to get some more research now that's looking at tension and distortion in the linea alba. But in terms of healing it, we now know, so for a while it was always about, okay, don't do crunches, don't do planks, don't do twists, don't do this, don't. And then people are like, oh my God, I've got diastasis, I can't move anymore. And so for a while, nobody wanted to kind of put themselves out there to question. And one thing that I always looked at, I said, okay, well, crunches are supposed to be bad, but the element of checking for diastasis is a crunch. Right. And what happens when we do that, it brings the rectus together. So how is it that is making a diastasis? Is that not something that could be potentially making it better? So that was always a point of debate over the years. But what's happened now is there's more research that's now trying to point to the fact that it's about the integrity of the connective tissue as opposed to the interrecti distance. I'm not saying that that's irrelevant, but we have to get people away from thinking, I need to close my diastasis and I'm not healed until that's closed. Well, it's never fused together. It's never totally closed. And you might've always been here. So we don't have an accurate starting point in comparison to where you are now. So,
and I think about that. I mean, I had a huge separation, and, you know, as time goes on, it pulls in. And I remember someone telling me, oh, you're in your 3rd trimester. You shouldn't do any ab work. And I'm like, great. So then I'm going to give birth and I'm going to have this, you know, no core. I will have core muscles. We all know it's from your shoulders all the way down to your hips. I get it. Okay. But my abs were just like, you know, like waving in the breeze here. I just gave birth to this huge beast of a child. So I've got all this space and no ability to support myself.
And
so
part
you
of that
should
goes back
always maintain your core. Yeah, you can.
Part of it goes back to the alignment. So the principles we were talking about before are what needs to apply from a healing perspective. So if you have paid attention throughout pregnancy, there's less likely that it will be a major issue after. If you haven't, and now you're faced with diastasis after, we look at the adaptations of the body and potentially there's non-optimal posture. And maybe there's pressure that we're not managing well that's going against that connective tissue. But so we have to optimize the alignment, the breathing, and the coordination, which it starts. So it's ABCs. It starts with the pelvic floor. We need to get in the proper alignment. We need to do the core breathing, and we need to make sure that we're activating the pelvic floor, because that elicits the co-contraction of the transversus. And we also need to work our glutes, because that tensions the thoracolumbar fascia, which all translates into healing the abdominal wall. And it's not about how we close that gap. It's about gaining the integrity of the connective tissue.
And you've got to keep the connective tissue healthy. And connective tissue is not going to maintain its own health unless it's got the musculature that's attached to it that's very vascular.
And the nutrition.
Yeah, exactly. So now that we've got that figured out, why don't these experts listen to us? I can't believe this. I can't believe just 45 minutes ago, I was walking my dog. I can't believe that we're done, ladies. I want to thank you so much, Brittany. Thank you so much for joining us. Gretchen, thank you. Kim, thank you. I love this stuff going on. I'm going to end our webinar, and I might even show you guys 2 videos. This is very exciting. We have a new aqua convention coming up, and it's coming up. We're very excited. It's going to be in May. Here we go. May 3rd. So this is very exciting. And we also have our certification smash, which is just next weekend. So this is wonderful. our fabulous Mike Lieber always creates our cinematography. I thank you ladies again for joining me. I look forward to seeing you all at our Aqua and our Certification Smash. And in May 21st through 23rd, we're having our live stream mania. Gretchen, get ready for this. It's live stream mania express. So we're shortening the sessions so they're only an hour in length so we can give you more sessions and more variety. So thank you guys for joining us, and we will see you next Tuesday. Good night all.
Thank you.